The University of Texas system offers the UT Select Medical Plan to eligible employees, retirees, and their families. It is a Blue Cross Blue Shield of Texas PPO plan with pharmacy benefits provided by Express Scripts. In this video, the Office of Employee Benefits will tell you about UT Select eligibility, plan design, benefits, and the Living Well program. Throughout this video, we'll refer to specific pages in the UT Select Health Benefits Guide where you can access more information. The guide is available at utbenefits.link/UT-Select-Plan-Guide. Plan eligibility. Medical coverage is included in the basic coverage package for all benefits-eligible employees and retirees. Their eligible dependents may also enroll in coverage. UT Select is the medical plan for active employees and their dependents, non-Medicare retirees, and non-Medicare dependents of retirees. The UT Care Medicare Advantage plan is for Medicare-eligible retirees and Medicare-eligible dependents of retirees. For details on UT Care, visit utbenefits.link/UTCare. Premiums. The state of Texas and your institution contribute premium sharing funds to pay for some or all of the cost of your basic coverage package and a portion of any dependent medical coverage. Employees can find their monthly premiums chart at utbenefits.link/EMP premium sharing. For retirees, visit utbenefits.link/RET premium sharing. UT Select members who use tobacco products or e-cigarettes pay an additional surcharge of $30 per month with a maximum family surcharge of $90 per month. Premiums collected through the program go towards additional wellness opportunities for the UT community. Plan design. As we discuss plan design and benefits, you may find a health coverage glossary helpful. It's available at utbenefits.link/glossary. UT Select is a self-funded preferred provider organization plan. We partner with Blue Cross Blue Shield of Texas and Express Scripts to help manage the plan. However, as a self-funded plan, every dollar spent to pay for medical and prescription claims is funded by members, UT institutions, and the state of Texas. Two ways you can help moderate costs for you and all plan members are by using in-network providers and working with a Blue Cross Blue Shield health advocate. Your health advocate can connect you with plan resources and help you find high-quality, cost-effective medical services. Plan network. As a preferred provider organization plan, or PPO, the plan contracts with medical providers and facilities to create a service network. Each time you or one of your covered dependents need healthcare services, you can visit an in-network or out-of-network provider. You pay less and receive higher levels of benefits if you use doctors, hospitals, and other providers that belong to the plan's large network. In-network providers and facilities cannot charge you more than the Blue Cross Blue Shield of Texas allowable amount for covered services. Some out-of-network providers can charge more than the allowable amount. This can result in balance billing and a significant out-of-pocket cost to you. Plan members can access a special tier of healthcare services within the network. The UT Health Network is a collaboration between several UT institutions and the UT Select plan to allow members more benefits. It offers even lower co-pays and co-insurance when you receive services from certain UT providers and at certain UT facilities. Find in-network and out-of-network charts plus UT Health Network details on pages 7 through 12 of the UT Select Guide. Geographic location. Benefits are based on the subscriber's residence on record with their HR or benefits office. In-area coverage applies to members who reside in Texas, New Mexico, or Washington, D.C. Medical costs may differ for out-of-area members. See details on pages 11 through 12 of the UT Select Guide. Plan and member costs. All plan costs discussed below are for in-network services. They are based on the plan year running from September 1st, 2023 through August 31st, 2024. Your deductible and maximums reset once the plan year ends. The annual deductible is the amount of out-of-pocket expenses you must pay for covered services before UT Select pays benefits. The annual deductible is $600 per individual and $1,800 for a family. Copays and prescriptions do not count towards your medical deductible. Some services, like in-network, in-area office visits, are not subject to the deductible. With these types of services, you pay only a copay, regardless of whether you've met your deductible. Aside from coinsurance, the other type of cost share between you and the plan is a copay. A copay is the set amount you pay for certain medical services and prescription drugs at the time of service. We'll talk about specific copays in the following section. Coinsurance refers to the medical expenses you and the plan share after you meet the deductible. Your in-area coinsurance is 80-20. That means the plan pays 80% of the allowable amount for covered services after you meet the deductible, and you pay 20%. For the UT Health Network, coinsurance is 90-10, so you will pay 10% of the allowable amount after meeting the deductible. The maximum you'll pay towards coinsurance is $3,500 per individual and $10,500 for a family. Copays are not included in the coinsurance maximum. The annual out-of-pocket maximum is the most you will have to pay for all eligible in-network expenses incurred during a given plan year. It includes copays and covered prescription drugs. Individuals have a $9,100 annual out-of-pocket maximum, and families have an $18,200 maximum. UT Select pays 100% of the allowable amount for covered charges beyond this. Out-of-network services have a higher deductible and no coinsurance maximum or annual out-of-pocket maximum. This is important when considering where to receive medical services. Benefits. Let's discuss a few features of the UT Select plan. All costs below are based on in-network, in-area coverage. The plan offers $30 primary care visits and $50 specialist visits. With UT Health Network providers, visits are $10 at employee clinics, $20 for primary care services, and $40 for specialist visits. UT Select participants have no copay for preventive care. Examples of preventive care are routine annual physicals, cancer screening mammograms, prostate cancer screenings, and well child care. You also have no out-of-pocket costs for lab and x-ray services associated with office visits. Your medical providers may offer telehealth services by phone or video. You'll pay the same amount as in-person visits with the convenience of meeting from home. You also have unlimited access to free virtual visits with MD Live. You can receive care when and where you need it, 24 hours a day, for many non-emergency medical conditions. You can also book no-cost virtual behavioral health appointments with a licensed therapist or psychiatrist. Register at mdlive.com/bcbstx. Progeny is a fertility and family building benefit designed to support all paths to parenthood. It removes barriers to care so you and your doctor can create the customized treatment plan that is right for you. Progeny is available to employees and their spouses once they have been continuously enrolled in a UT System employer medical plan for at least 12 months immediately prior to accessing this benefit. The Summary of Benefits and Coverages document is available in English and Spanish at utbenefits.link/SBC. It includes examples of how the plan would cover various medical needs. To ask specific questions about benefits, contact your Blue Cross Blue Shield health advocate. Call them at 866-882-2034 or utilize the Blue Access for Members chat function available through bcbstx.com/UT. You can access several behavioral health resources like Learn to Live, a digital service offering self-paced behavioral health courses. You can also utilize the Employee Assistance Program, or EAP for short. It's a confidential service available through your institution at no cost to you. They can help you manage personal and professional challenges through short-term counseling, consultations, and referrals. For individuals looking for a therapist, Headway is an easy-to-use platform that helps match you with an in-network provider based on your needs. You're able to see therapist availability and book directly on the site. Try it out at headway.co/m/BCBSTX. Learn more about behavioral health services at utbenefits.link/video library. Value-added services. Your medical plan includes additional value-added services with no out-of-pocket costs. Hinge Health helps members conquer chronic pain without surgery or drugs. Omada aids participants in reducing the risk of type 2 diabetes. Teladoc Health is a simplified digital approach to diabetes and hypertension management. Ovia offers fertility, pregnancy, parenting, and menopause support. Details about these services are on pages 36 through 38 of the UT Select Guide. Your UT Select plan includes prescription drug coverage administered by Express Scripts. The annual deductible for prescriptions is $200 per member. This is separate from your medical plan deductible. You can obtain your prescriptions via a retail network pharmacy. For members with maintenance medications, save time and money with the Smart 90 program. Receive up to a 90-day prescription at a time through Walgreens, UT Pharmacies, and Express Scripts home delivery. Another way to save on your prescriptions is by asking your provider whether the generic version of a medication is right for you. Visit pages 56 through 61 of the UT Select Guide to find additional prescription plan features. Living Well. The UT System Living Well program supports employees, retirees, and their dependents in leading happier and healthier lives. You can take advantage of several Living Well options throughout the year, like seasonal wellness challenges, tobacco cessation resources, and discounted fitness programs. Register for the UT Living Well platform powered by Limeade. It helps you stay up to date with wellness offerings, connect with colleagues, and find personalized activities to meet your wellness goals. It's available via browser at ut.limeade.com or in the Limeade One app. Learn more about Living Well programs at utbenefits.link/livingwell. Additional resources. To access your medical coverage information online, go to bcbstx.com/ut. Visit bcbstx.com/mobile for links to download the mobile app. The Blue Cross Blue Shield Nurse Line is available 24 hours a day at 888-315-9473. Find your prescription information online at express-scripts.com/ut. To speak with Express Scripts, call 800-818-0155. The Office of Employee Benefits website is utsystem.edu/benefits. Follow us on Facebook at UT Benefits. Thank you for taking the time to learn about your UT Select medical plan.